going into the topic, I have a riddle for you. Try to guess what this is. It's related to my topic. I start as a berry, but I'm not sweet to bite. I'm roasted till I darken, then I'm ground out of sight. I can be bitter or I can be sweet, dark is night or light is dawn. Too much of me brings chaos, and too little leaves you withdrawn. I wake to vary, and yet I never sleep. What am I? Any guesses?
Coffee.
Yeah, it's coffee, it's caffeine. And you know that caffeine is the most widely used psychostimulant drug that, all of us would have taken coffee in the morning, right? So let's talk about what psychostimulants are, how they work, and what they do to the body. So by the end of the session, I hope to shed some light on what are psychostimulants, coffee as a psychostimulant, amphetamines, their mechanism of action, side effects and uses, ADHD and psychostimulants, the great paradox, and cognitive enhancers. Okay, so let's start with what are psychostimulants. So it's actually self-explanatory. Psychostimulants, as the name suggests, are drugs that stimulate the central nervous system. So they improve physical and mental function and produce alertness, wakefulness, and increase your energy. And coffee, as I already said, is the most popular psychostimulant drug. So how does coffee work? We know that ATP is the energy currency of the cell, right? And so once you've been doing a lot of work and you expend a lot of energy, your ATP will get broken into adenosine. So all the high energy phosphate bonds, they will get broken up and you will be left with adenosine. So when adenosine builds up in the brain, it will go and bind to adenosine receptors. And when adenosine binds to these receptors, it will cause a decrease in neuronal firing and it will cause drowsiness and sleepfulness. So how does caffeine work? Caffeine is an antagonist of adenosine. So it will go and bind to the adenosine receptors. There are primarily 4 types of adenosine receptors: A1, A2A, A2B and A3 receptors. Caffeine will mostly bind to A1 and A2A receptors, and it will, as it is an antagonist, it will promote neuronal firing, it will increase the neuronal firing, and it will cause stimulatory effects, and that's why you feel like so energetic after you take coffee. So moving on, there is also another interesting thing that is related to the mechanism of caffeine, which is called as the A2A D2 receptor heteromer model. So we know that generally you read of one receptor alone, right? But now think of a unit of 2 receptors. So the adenosine receptor and the dopamine receptor, they function together as a unit. Alright, so when adenosine goes and binds to its receptor, the binding of dopamine to its D2 receptor, it decreases. And so we know that dopamine is related to feelings of pleasure and mood elevation. And when adenosine prevents the binding of dopamine to its receptor, there is decrease in positive effects like mood elevation or feelings of pleasure. So whereas if we take coffee, it as an antagonist to the adenosine receptor, it will improve dopamine binding to the D2 receptor and improve feelings of pleasure, mood elevation and other positive effects. So I have a video on this. It's not working. Okay, moving on to the next drug, amphetamines. So all of us would have heard of amphetamines because they are popular drugs of abuse, right? But amphetamines can be used medically and they are psychostimulants that increase the amounts of dopamine, norepinephrine and serotonin at the synapse. And they do this by 2 ways. One, they promote the release of neurotransmitters like dopamine, serotonin and norepinephrine. And number 2, they prevent the reuptake of these neurotransmitters. As you can see here, I've given a synaptic terminal, right? So here you can see that there is DAT, which is dopamine transporter. Now generally what is dopamine transporter or monoamine transporters, what do? They take up the neurotransmitters that have been released into the synapse and they push it back into the neuron, right? And then you also have something called VMAT, so vesicular monoamine transporter. So this will actually transport the neurotransmitters like dopamine, serotonin and norepinephrine back into your synaptic vesicle. So that when your action potential comes, it will cause release of the neurotransmitters by vesicular transport, right? So what amphetamine does is it will go through the monoamine transporter like DAT. It will go into your neuron and it will interfere with the functions of vesicular monoamine transporter, and it will prevent the entry of dopamine, serotonin and norepinephrine into the synaptic vesicle. So in turn what happens is the concentration of these neurotransmitters will increase within the cytoplasm of the neuron, and then because the concentration is so high, they will move out of the neuron and into the synaptic terminal through the monoamine transporters like DAT and NET. And this is what you call as reversal of transport, because essentially these monoamine transporters are used for pumping neurotransmitters back into the neuron, right? But now there is reversal of transport and neurotransmitters are pushed into the synaptic cleft. And if you have noted, I said that these monoamine transporters are what amphetamine uses to get into the neuron, right? So as it also competes with dopamine, serotonin and norepinephrine for this transporter, and thereby it prevents the reuptake of these neurotransmitters into the neuron. So just two mechanisms. Basically all that amphetamines do is they increase the concentration of dopamine, norepinephrine and serotonin in your synapse, and they do this by inhibiting your reuptake and by promoting your release. Okay, so two primary things: reversal of transport and exchange diffusion. Alright, so the pharmacokinetics. Absorption, amphetamines are easily absorbed orally. They have a very high volume of distribution and they are metabolized in the liver by the enzyme CYP2D6 and they are excreted through the urine. Let's move into the side effects of amphetamine use. So a lot of these drugs, they are being abused, right? So what are the side effects that they cause? So primarily, they cause an increased release of neurotransmitters like dopamine and norepinephrine, which are catecholamines, right? So because of this catecholamine excess, they will go and act on the beta receptors in the heart and the alpha receptors in your blood vessels, and they will cause tachycardia and they will also cause vasoconstriction. So this will increase the risk of arrhythmia, stroke and myocardial infarction as well. Another thing is, since they are psychostimulants, they will keep you very active, awake and alert, and they will cause insomnia and irritability as well. And they do this by acting on the reticular activating system. The final thing is, they will cause appetite suppression. Because of serotonin's effect, they will cause appetite suppression and weight loss. Okay, so the interactions. They interact with monoamine oxidase inhibitors. So monoamine oxidase inhibitors, they prevent the breakdown of monoamines, and amphetamines increase the release of monoamines, right? So there is basically a huge amount of monoamines that are getting produced, and so that will cause these side effects that I talked about, and especially they will cause hypertensive emergency. And serotonergic drugs like SSRIs and tricyclic antidepressants, they will also increase serotonin concentrations in the body. Along with amphetamine, they will produce serotonin syndrome. And these are drugs of abuse potential. They cause addiction, dependence and tolerance, and they are also neurotoxic. Moving on to methylphenidate. So methylphenidate is very similar to amphetamine. The only thing is it doesn't improve the release of these monoamines, rather it inhibits the reuptake of the monoamines alone. And it is preferred for childhood pediatric group patients who are suffering from ADHD. Alright, so the use of psychostimulant drugs, ADHD, narcolepsy, because narcolepsy is when there is excessive sleepiness in the daytime, right? So this causes insomnia, I said. So it is used for narcolepsy, and it's used for resistant depression, and it's also used for obesity and binge eating disorder because it suppresses your appetite and causes weight loss. So here's the big question. ADHD, the name suggests hyperactivity, right? Attention deficit hyperactivity disorder, and I'm saying that I'm giving you a stimulant drug to treat ADHD. Hyperactivity and stimulation, that seems counterproductive, doesn't it? But this is paradoxical because in ADHD there is a theory called low arousal theory. It basically states that people with ADHD, they have a low level of neurotransmitters like dopamine in their brains. So since they have a low level of these neurotransmitters that give them feelings of pleasure and happiness, they are constantly looking for other activities to improve their feelings of happiness. Basically something that gives them a good happy feeling, right? And so what they do is their baseline levels of dopamine are very low, and to improve these levels we can give your amphetamines so that they improve the levels of these neurotransmitters, and they won't constantly seek stimulation while doing mundane activities. Alright, so cognitive enhancers, that is smart drugs. So cognitive enhancers or nootropics are those drugs which improve cognitive functions like memory, focus and intelligence. And common classes of these are prescription drugs like amphetamines, especially methylphenidate and modafinil are used as stimulant drugs. Other than that, there are supplemental drugs which are herbs. You can take caffeine. There is something called ginkgo biloba, ashwagandha, and an Ayurvedic drug called Brahmi, which is also used. And you can also use racetams. So, without taking too much of time, I'm going to explain what supplements do. Basically, they have an antioxidant function. So, they prevent the oxidative tension on the neurons, and they prevent, they are neuroprotective. Other than that, they also promote synaptic plasticity. They are anti-inflammatory, and they improve blood flow to the brain. So, the picture on top is that of ginkgo, and the picture on the bottom is an Ayurvedic drug called Brahmi. And also racetams, they help by enhancing the activity of AMPA receptors, and thereby they increase your synaptic transmission. They also enhance the cholinergic system and improve cerebral blood flow. Okay, so here's a question: can you become smart because of a pill? Just by taking a pill, can you become smart? Well, no. This has a lot of arguments regarding it. But the basic thing is you should not become smart because of a pill. And the reason is if you take stimulants like amphetamines or methylphenidate to improve your alertness and your stimulation, especially like the night before the exam, if you take this, and if you take it continuously, see what will happen is the side effects are so much more. You have to assess the risk-benefit ratio, and the risks of cardiac events, and the risks of stroke, and the risks of weight loss and irritability and insomnia are far too great. So these smart pills, according to me, should not be used in normal individuals, but they can be used in conditions like Alzheimer's, ADHD and Parkinson's to improve the cognitive status of people and to improve their quality of life. So as a summary, psychostimulants are basically substances that stimulate the central nervous system. Amphetamines, they work by two mechanisms, that is exchange diffusion and also by reversal of transport. Cognitive stimulants are used for the treatment of ADHD, narcolepsy, obesity and resistant depression. And you also know the various categories of nootropics or cognitive enhancers. That is your stimulant drugs, your racetams and also your supplements. So that is it. Thank you for listening.